most expensive healthcare system in the world, ranked last overall in this international comparison. How is that possible? And why are Americans paying so much for it? Take a look at this chart. This chart right here illustrates how the United States lags internationally in its overall performance for healthcare. We can see the arrow on the left shows us that the higher the performing country, the higher the place. And the lower on that arrow is the lower performing. We can see Australia is number one, and then it goes down to the Netherlands, the UK, New Zealand, and you can see the rest of them. You can see where the US falls in this overall category. I am Dr. René Padilla, and welcome to Powernomics, where we help you understand policy and economics that affects your life. There are three reasons that we're going to be talking about as to why the United States spends more on healthcare but ranks low overall. Number one, weaker outcomes. Two, barriers to access. And three, higher costs. The United States spends more on healthcare than any comparable wealthy nation. More than 16% of its entire economy goes towards healthcare. Let's take a look at this other chart. It illustrates the amount of money that we as a country are spending for healthcare. We can see here that by far we are spending the most, and the other countries are clustered together. But we can also see from the column on the right that the country that spends the least is Australia, with 9.8% of their GDP. We can look at countries like Canada that spends 11.26%. Sweden spends 10.9%, and you can see the rest, with France spending 11.9%, which after the United States, France is the country that spends the most on healthcare at 11.9%. That is 5% less of their GDP than we do. Yet in this international comparison, the United States ranks last overall. If you value clear, data-driven analysis, like the video and subscribe to the channel. So let's take a look at outcomes. The first reason the United States ranks low in healthcare is outcomes. Obviously, outcomes are an important part of healthcare. We want to have good outcomes. So now, the United States performs poorly on several key health measures. Let's take a look at this chart. We can see here the different performance rankings. We can see at the very top the overall ranking. We can see that Australia, the country that spends the least amount of money, has the best healthcare in the world. We can see our neighbors up north, Canada, they're number 7, France is 5th, Germany is 9th, the Netherlands is 2nd, New Zealand is 4th, and you can see the rest with the UK being number 3, the United States number 10. We can look at access to care, and we can look at the comparisons there by country, where the Netherlands has the best access to care. We can look at then the care process, and New Zealand has the best process, and this is where the United States ranks the best at number 2. Administrative efficiency, we can see that the UK ranks number 1 at that. The US ranks number 9. Equity, Australia ranks number 1, the United States ranks number 9. And health outcomes, Australia ranks number 1, and we rank number 10. Americans on average live shorter lives than people in many other high-income countries. Let's take a look at this chart. The chart shows us what we had previously seen, that Australia is the highest performing country with Switzerland having one of the highest life expectancies in the world, and then it goes down to New Zealand, Canada, France, with the United States at number 10. So now life expectancy comparison. Life expectancy is one of the clearest indicators of a country's overall health. And by that measure, the United States lags behind many of its peers. The United States has also higher rates of preventable deaths. Let's take a look at this chart. We can see the life expectancy comparison is Switzerland is number one at 84 years on the average for life expectancy. Australia, it's also at 84. The Netherlands is at 83, Sweden 83, France 83, Canada at 82, Germany is 7th at 81, the United Kingdom at 81. I'm not sure why New Zealand was placed 9th since they're 82. But what we care most about is that life expectancy in the United States is 78 to 79 years old. So if we're looking at this metric, we can see the life expectancy in the United States is a whole 5 years less than it is in Switzerland at 84. In many cases, these are deaths that could have been avoided with earlier diagnosis, timely treatment, or more consistent access to care. The United States also performs worse in maternal and infant health than many comparable countries. Let's take a look at a table. This table here shows us maternal and infant health comparisons. We can see that for every 100,000 live births in the United States, 22 to 33 mothers die. We can also see that for every 1,000 live births in the United States, 5.4 infants die. If we look at the rest of the other countries, the difference is significant. Look at the United Kingdom. The maternal mortality is 6 to 8 deaths per 100,000 lives. And their infant mortality is 3.6. And from there on, you can see the rest of the countries. You can look at France, you can look at the Netherlands, you can look at New Zealand and Australia, which is the country with the best health care in the world. They are at 4 to 6 maternal deaths for every 100,000 lives, births, and infant mortality 3.1 for every 1,000 live births. One of the most concerning aspects of this table is the gap between the United States and what all of these other nations are able to achieve. These are key indicators used around the world to measure healthcare performance. And here again, the United States falls behind. In other words, the most expensive healthcare system in the world is not producing the best overall results, as we can see. To be clear, the United States does lead in certain areas, including medical innovation, specialized treatment, and advanced technology. But at a system-wide level, outcomes remain weaker than many peer nations. So if the United States spends more but achieves worse outcomes, how accessible is that care? The second reason the United States ranks low is access. Let's take a look at the next chart. We can see from this table that the US and New Zealand trail their peers for equity in healthcare access and experience. But in this comparison, the United States ranks last in access to care. A major difference is that every other country in this comparison has a universal healthcare system, helping to reduce the financial barriers and making routine care easier to access. So that seems to be the key to better care. Many Americans face high deductibles, copays, and out-of-pocket costs. For some families, those costs become financially devastating. A widely cited study published in the American Journal of Public Health estimated that around 530,000 bankruptcies are filed each year linked to medical bills and illness-related financial strain in the United States. And for many households, cost determines whether they seek care at all. Compared to other wealthy countries, Americans are more likely to delay or skip care because of cost. Access is also shaped by the complexity of the system. Coverage often depends on employment, income, or eligibility rules. In other words, healthcare in the United States is available, but not always accessible. And when access is limited, costs and outcomes are affected. The third reason is cost. We can see from this table again that the United States spends by far a lot more money on its healthcare system than the rest of its 9 other peers. And a major reason is prices, hospital care, prescription drugs, and many medical services cost more in the United States than in other wealthy nations. Another example was surprise billing. Before federal reform, studies found that roughly 1 in 5 emergency room visits could lead to an unexpected out-of-pocket charge for privately insured patients, meaning that even if you had health care coverage and you went to the emergency room, about 20% of those people would get additional charges that they were not even aware of. Since the No Surprise Act took effect in 2022, many of those financial burdens have been reduced, with patients now protected in many emergency billing situations. It is also a reminder that public policy can make a real difference when lawmakers directly address costly market failures. The system is also more complex with multiple insurers and billing systems, leading to higher administrative costs. Americans also tend to pay more for prescription drugs than patients in comparable countries. Let's take a look at the next table. As we can see here, the United States is the country that spends the most on prescription drugs. We can see here that per person, the United States is spending $1,713 per person on prescription drugs. The next country is Germany, then Switzerland, and you can see the different numbers. You can look at New Zealand that spends a whole $1,100 per person less than the United States does. Even the UK spends $700. So again, one of the bigger concerns is the fact that there is such a big gap. If we look at the difference between the United States and the second country that spends the most, being Germany, it is a $600 per person difference. And it goes down from there. That is also a big part of the reason as to why we pay more. In short, America's healthcare spending is driven less by higher use and more by higher prices. But now let's take a look at what other countries are doing. So it helps to ask another question. What are other top-ranked countries doing differently? Countries such as Australia, the Netherlands, and the United Kingdom often perform better overall while spending much less than the United States does. First, many provide broader and simpler access to care. That means fewer people delay treatment because of cost, and more health problems are caught earlier. Second, many systems use stronger cost controls on hospital prices, prescription drugs, or administrative spending. Third, many place greater emphasis on primary care and prevention. In other words, they invest more in keeping people healthy, not only treating them after people become seriously ill. And this is a place that the United States is moving towards, and that is a good thing because it will save us money overall. No healthcare system is perfect. Many countries face wait times, budget pressures, but this comparison suggests better results are possible without spending as much as the United States does. That may be the most important lesson of all from this video. Conclusion. So why does the United States spend more but rank low in healthcare? The answer comes down to weaker outcomes, barriers to access, and higher costs. And other countries show that better results are possible without spending as much. The United States has one of the most advanced healthcare systems in the world, but higher spending has not translated into better overall performance. Now remember that it is not about believing what we want to believe. It is about knowing what we need to know. I'll see you next week.